Diabetes is the second most common cause of death in the country. That is according to the latest Statistics South Africa report on mortality and causes of death released earlier this year. About 6% of South Africans live with a condition. Today marks World Diabetes Day, and as part of commemoration, the Department of Health is calling on families to eat healthy and exercise. November is World Diabetes Month, and this year's theme is Diabetes and the Family. The Department of Health wants to promote the role of the family in the management, care, prevention and education of diabetes. Over 3 million South Africans have been diagnosed with diabetes. All right, we now take this discussion further on World Diabetes Day, and we are joined by Margot Mc.Cunisky. She is the National Manager at Diabetes South Africa, and she joins us now live from our studios in Sea Point. Margot, good afternoon to you. Thank you so much for coming through. Let us first get an understanding of what condition is diabetes and what causes diabetes.
Well, there's two main types of diabetes, type 1 and type 2. Type 1 affects younger people from birth to about 35 years old. And this is an autoimmune disease. In other words, the body's immune system destroys the insulin-producing cells in the body, and so the person is not able to make use of the food that they're eating and will consequently die without treatment and regular insulin injections. So that is type 1, which affects about 5% to 10% of the people with diabetes. Type 2 diabetes is a different condition in that the person may have too much insulin, or the insulin isn't functioning properly, and so they would need to possibly lose a bit of weight, start leading a healthy lifestyle, eating healthy, exercising in order to manage and control the blood sugars. If necessary, they may have to go onto medication, tablets, which will help reduce the blood sugar, or later on, because diabetes is a progressive disease, they might end up having to have insulin injections regularly every day.
Yeah, and I suppose this type 2 diabetes is the most dangerous one because of the symptoms can be very mild and they may only develop gradually, isn't it?
Yes, over a period of about 7 years, sometimes the person is not aware that they have pre-diabetes, are on their way to developing diabetes, and you know, so while we have about 3.5 million people with diabetes, there's at least another 50% that are undiagnosed and on their way to developing it.
Yeah, and the prevalence really of diabetes here in South Africa, let's just reflect on that in terms of the numbers. 3.5 million South Africans are diabetic?
That's correct, yes, and it's the second leading cause of death in South Africa behind TB. So it's overtaken even HIV and AIDS, and we really have a serious problem here. South Africans need to start living healthier lifestyles.
Because I was about to ask that, how do we, get away and how do we avoid diabetes? Because in some instances it's hereditary. If your parents have it, there's huge possibility that you may have it as well.
Yes, that's true. So I'm holding up the symptoms of diabetes. These are some of the symptoms that one should look out for. And if you have any of these symptoms, rather go to your nearest pharmacy and have your glucose checked, or go to your doctor if you're going to the doctor for other treatment, and ask him to do a blood glucose check, because it's really important to be diagnosed early to prevent further complications. There's some very serious complications associated with diabetes.
But in terms of its prevalence in young people, let's just talk a little bit about that. I know that you were supposed to bring us an 80-year-old who lives with diabetes. How prevalent is it in young people? Because around 76% of diabetes-related deaths in South Africa, they occur in people younger than the age of 60.
That's right. And also children with type 1 diabetes, there's 43% mortality in young people and children with diabetes. So it's really important that children with diabetes, especially type 1, are given specialized treatment and education and management. And that's where Diabetes South Africa comes in, because we do offer children and youth outreach and outreach to parents. Being a non-profit and public benefit organization, that is one of the roles that we play.
Yeah, and earlier today, Margot, I read a very disturbing report. There is a new study by the International Diabetes Federation that it actually revealed that South African parents struggle to spot diabetes in their own children. So how do we go about spotting it, and what do we need to take into consideration?
Well, the symptoms of diabetes will be very severe in children. The symptoms that I just held up, those ones are the ones to look out for in children, because they will experience them, you know, as opposed to type 2, where the symptoms are there but perhaps are dismissed and only develop over a period of time. With children, it would be more of a sudden onset, and you would know that there was something wrong. However, with type 2 diabetes, I think all South Africans should be eating healthy and exercising regularly and making that example for your children, because children will do what you do, not what you say. So, you know, if you're telling your children, don't drink alcohol, don't smoke, you know, eat healthy, stop eating junk food, well, you need to be setting that example for them in the family. And this is why family is so important when managing diabetes, because you need the whole family to buy into the concept of healthy living, in order for the children to avoid developing diabetes, especially if there is a genetic factor in play. In other words, somebody in the family has previously had diabetes or has it currently.
Yeah. I also read an interesting article on pre-diabetes. Apparently 5 million or more people are estimated to have pre-diabetes. That is when blood sugar levels are higher than normal but not high enough to be considered as diabetes. School us a little bit on this, because I remember after giving birth to my son, I was told that my sugar levels are very low. I should be very careful, because when my sugar level shoots, that may cause diabetes or stroke. So how dangerous is this pre-diabetes?
Well, pre-diabetes is the step before developing diabetes. So at that stage, you can prevent or delay yourself from being diagnosed with diabetes. And by making changes in your lifestyle at that stage, you know, then you can make a difference. Once you're diagnosed, diabetes is with you on your life's journey. So whilst you might be able to control it well and live a normal life, the minute that you start not exercising, not eating healthy, putting on weight with type 2 diabetes, then your sugar levels are going to go up, and then you are going to develop complications if that endures for a time. You will definitely develop complications, and the complications of diabetes are very severe: blindness, amputations, heart attack, stroke, kidney failure, and early mortality. So you know, it's very important to take diabetes seriously and try and prevent or delay it, and if you have diabetes, to manage it.
Yeah, I had the Department of Health in KwaZulu-Natal earlier saying that they have about 2,500 leg amputations a year in KwaZulu-Natal only. So this surely shows, Margot, that we need to have education, awareness more often on diabetes itself, and of course the complications that come with the condition.
That's correct. We've, for Diabetes Month and for the next year, we have a booklet which says, Get Up and Go, and it's sponsored by Pick n Pay and Diabetes South Africa, and it's going to be available from our website, www.diabetessa, one word, 2 S's, and then .org.za. Now this has 30 pages of information on diabetes and how to manage it, and another 30 pages which have recipes and information on managing your diabetes through diet and lifestyle. So I would encourage people to go onto our website in order to access the booklet and educate themselves on diabetes. And there's some delicious recipes that are available in there. And also to take out Diabetes SA membership so that we can have a continuing conversation and help support people with diabetes, because that is what we are about. We're a family of people with diabetes helping other people with diabetes. So contact us. We're available and ready and willing to help support and be there for you when you need information or help.
All right, a beautiful job you're doing there, Margot. Thank you so much for coming through. Margot Mc.Cunisky, she's the National Manager at Diabetes SA, talking to us about World Diabetes Day, of course. And we've actually requested your take, and what do you think needs to happen? How do we move away from, you know, being a diabetic nation? 3.5 million South Africans are diabetic. So let's take a look at some of your tweets that you sent through.